If you've been following the news, you will have realized that in some states of the country, many local governments already about 121 are said to have been infected by cholera outbreak, and the numbers of deaths from this outbreak are still growing. But of course, Fcta administration is not waiting until when it's here before taking actions, and therefore we have invited people from the Fcta Public Health Department. Of course, who can we invite better than the State Epidemiologist herself, Dr. Theresa Ekaete Nwachukwu. She is the State Epidemiologist, Fcta Public Health Department. Thank you very much for joining us, madam.
Thank you so much.
And of course, joining her to help her, make sense of everything that we will be talking about in the next half hour is Mrs. Hannatu Bitrus. She is Health Educator and Social Mobilizing Officer, Fcta Public Health Department. Thank you very much for being here.
My pleasure, sir.
All right, let's start from the start with you, the State Epidemiologist. How vulnerable is the Fcta as we speak with respect to cholera outbreak?
Thank you for that question. The Fcta is extremely vulnerable because apart from being the capital of Nigeria, it's right at the center of a travel nexus, right? So people are coming in from the north, south, east, and west. And because the travel time is so short, and of course by flight, you can literally get from any part of the country into the Fcta within an hour. It means that we're extremely vulnerable. So if someone brings even contaminated food from, say, another state, a nearby state, into the Fcta, it will still be highly contaminated, right? So we're extremely vulnerable. We have borders with about 4 or 5 states surrounding us, some of which already have cholera. The public interest is extremely high. The wash facilities in most of our communities are not impeccable, are not excellent. There's still open defecation. So all the factors that make for an outbreak are present. And so we really have to be very intentional as a people and as citizens and residents of the Fcta to ensure that we don't succumb to this outbreak.
Mrs. Hannatu, of course, when outbreaks like this happen around us, and like Dr. Theresa said, you realize that the citizens, all states like places like Fcta must begin to activate some sort of measures to be able to contain the outbreak when it comes. What are those measures that are being taken, particularly with respect to mobilizing the citizenry, the residents of the Fcta, to be ready and to know what to do so as to prevent this outbreak within the territory?
Thank you very much. Like she has already rightly said, the main aspect of it is our environment, that's sanitation, environmental sanitation, both outside and inside our homes. We need to keep things in order, like even washing of hands, advising, talking to our children, talking to our parents, our mothers on how to take care of our environment and the inside and where we keep our food and whatever utensils we are using in the home and even in our surroundings. The environment should be kept clean by sweeping, tidying up the place, not leaving waste plates, dirty plates unkept, and the house is unkept. Those are the things that contribute in bringing all this kind of this thing into the house. So we talk to our parents, we keep hammering, we discuss about environmental hygiene and sanitation and cleanliness with the children, especially washing of the hand techniques. That we advise the children and parents. Okay,
Dr. Theresa, according to NCDC record, about 107 local governments have already been affected, and we have 1,528 persons infected so far. How many people has Fcta contributed to this number?
To that number, Fcta has contributed 1 case, and that 1 case is not confirmed. I always have to emphasize this. That 1 case is not confirmed. Now, as far back as March, we picked up a case. We're called from a facility that there was somebody who was stooling, and our team went in there and we took samples, and we tested and it was not cholera, but we had already reported it to the system. So FCT, if you look at that CTREB, you will see that FCT has 1 case as at the 24th of June, and we really would love to keep it that way. So right now FCT does not have a confirmed case of cholera in 2024. I have to emphasize that. So really serious thanks to the mandate secretary of the Health and Human Services Secretariat, Dr. Adedolakwa Fashawe. She's been working very hard. She's been on her case as far back as February to begin to put things in place. And as far back as February also, because we know that cholera is seasonal. We know that once the rains come, the tendency is there. So we always do prepare for it. So we did have an assessment of our own situation in terms of our preparedness, in terms of coordination, are we ready for that? In terms of surveillance, are we ready for that? In terms of case management, if people are sick, do we have the capacity to respond? In terms of IPC, infection prevention and control measures, do we have the capacity to vaccination, all of these things. So we went through that checklist. We do that every year to prepare ourselves, and we found where we have gaps, and we drew up a plan to fill those gaps so that if we do have cholera, and we hope not again, we'll be ready. So, and these are plans that we have prepared for February, March, and that was because of those plans. That was why we're able to pick up that 1 case of suspicion, which, like I've told you, we tested. It was not cholera, and so that's just the plans that we have.
Okay, in your opening remark, you did say that there are some practices that make a place vulnerable to cholera that are still in place in the FCT, such as open defecation. You also did mention the state of our primary healthcare centers that are still not in the shape that we would want to see them. Now, but you said we have hope. Where is our hope really? Is it more on hope? Are we hoping more on hope, or our hope is more on our level of preparedness should there be an outbreak?
Absolutely. There's no, I always say there's no need saying you're praying, you're hoping. What are you doing while you're hoping? The beautiful thing is that cholera has such simple measures to prevent it. For instance, you don't need money to wash your hands. Okay, so you need water and you need soap. And if you don't have soap, if you have sanitizer, if you don't have sanitizer, do you have ash? There are local things that we could use to clean our hands in the environment. So the simplest things, when we go into the communities, we find that people live literally on gutters. Like you literally jump over a gutter to sell your market. People have are roasting corn over gutters. People are roasting corn all around them. Everywhere is littered. Everywhere is filthy. I'm sure we don't expect that the minister is coming to clean that, or that the mandate secretary is coming to clean. These are things that in our environment, in our little way, we can tell the little ones, clean up this place. Just wash this place and pick up the garbage around you. So these are simple things. Again, open defecation. This is a habit. I'm sure we see this happen when you're driving on your way to work or you're walking in your communities. You see people early in the morning. And these are the things that prepare the environment, that prime the environment. Because once the rain comes, it washes all of this stuff into water sources. And so well water gets infected, contaminated, river sources get contaminated, streams get contaminated. The cattle and humans are drinking from the same source. So all of these are sources of contamination. The point I'm making is that simple things that we can do in our environment, in our own right. We have something that we call 50% solution. So if government has this percentage of solution, the FCT has this percent, you have 15% solution as an individual. 15% of what you can control. If you do that, you will find that the incidents or the opportunities for the infections to come will be reduced. So this is what we're encouraging everybody. All hands have to be on deck at this point. We don't want cholera in the FCT.
All right, Mr. Hannatu, Dr. Theresa has given us quite a mouthful of things that need to be done. And this now boils down to what mobilization officers are doing especially in our rural communities. What can you say about the level of your activities in sensitizing, mobilizing FCT residents, particularly those in our rural communities, to be aware of some of these little things that she has mentioned that they have to do and not wait for government before they take action?
And like everything that has to do with a preventive measure is a continuous thing that keep happening every now and then. We know it's not like in this time of our rainy season, yes, our foods that we buy from the market, some people just buy and come in and just give it to the children. They will not even bother to say, okay, wash your hand, or let me rinse this thing very well. Those are the things that like she rightly said, we need to like really work on our hygiene. Personal hygiene and environmental hygiene is very, very important. And as a help from educator and social mobilizer, we go around. We go around, we talk and talk and talk. We are not tired of talking.
So what are the methods that you deploy in getting this message across to the people?
Yes, we go to the community, straight to the head, to this community district head or any of the head around the area. We involve them in our activities. And we make sure that we visit them once in a while to put them in check. To say, okay, if you are doing this, yes, you are right. Okay, go ahead and do this. You must not have soap before you think you can sanitize or clean your hand. Like she said, ash, toka, you can use it, fetch and put it in a clean container. Keep it aside. When the children go out to play or coming back from school, before you give them anything, come, take small, wash your hand, do the hand washing and everything, then clean your hand. Then the food you are giving them, if you notice that the food is not, you did not cover it very well or something, you need to warm it again. Warm it very well before administering to the children to eat. We are talking about environment. We have environmental officers in public health that go around with us to support and to see that cholera is a zero thing in FCT. And I think we've been doing that all round the clock. No time, anywhere we enter, we talk about it. And most times, if you go anywhere, you see anything that is not clean or a place that is an eyesore, when you call, there is a prompt response. We will act, we will come immediately, and we will act on it, and things will be going well.
Dr. Theresa, I come back to you again, because one space where you can find young people in their large numbers at the same time has been schools.
Right.
And so I want to ask, what's been the involvement or engagement of your department with schools with regards to some of the enlightenment that you have mentioned and she has corroborated?
Thank you so much. We work with schools. Like you rightly pointed out, schools are a hub that these things can happen. If you look at what happens in schools, when children go to school, they're buying, this food that we carry around in buckets, puff puff, all sorts of things that children buy, meat. So kids buy these things and they eat them, they play around and all of that. So it's we're engaging schools. The health promotion department, that's basically the responsibility they do, to engage schools, to engage communities, to engage everyone in the cities, in the FCT around that. So I'm sure Hannatu can tell us more about the plan that they have for school, but I do know that they've been going around. I do know that our jingles, I'm sure you've heard some of the jingles on some of the radio stations. They're already being aired. So these are kids-friendly jingles that everyone can listen to and everyone can take action. So what we need to do, and of course we engage with the teachers, we engage with the parents through PTA associations and all of that. Remember, it's a big ecosystem. The health system is a huge one, so everyone has to be on deck. I'm hoping that everyone gets to listen to this program, and we've been to NTA. We're going to different media houses. That's another avenue that we use to sensitize. So we really thank you for this opportunity. But yes, we're engaging with schools. We're engaging, and if you're in school and you haven't seen us, we'll come round to you. But yes, we have reached as many schools as possible, and it's an ongoing activity. So.
Still talking about collaboration, one agency that I want to believe that your department should work closely with is FCT Ruasa, because everything revolves around water and sanitation, and that's, I think, the purview of that agency. What has been like your engagement with that agency?
So we practice what we call One Health.
Okay.
Right? One Health means that there's a nexus between human, environment, and animal sector. And so in the last few years, we have really gotten better at that. We weren't always so good at that. So whenever we have meetings, we bring in RUASA, we bring in Water Board, we bring in AEPB, Abuja Environmental Protection Agency or Board. So we work together. We bring in the environmental sector, we bring in agri sector, because we know that what happens in the environment directly affects human beings.
True.
So we work together. So yeah, we're working together. Again, they also have their roles, right? They have a role to play in terms of provision of water at the rural center. And I'm sure they have very detailed plans. So apart from that, we share work plans so they see what we're planning to do. I remember the last outbreak, we actually would go set out teams to go, and the teams would include WASH staff, RUASA staff, and they were actually taking water samples from the communities. They'll test the water samples, then they'll give us the results, and we can act on it based on what we saw. And it made a huge difference in our intervention at the community level. So yes, we work with RUASA, we work with Water Board. They invite us to their activities. We invite them to our activities, and we collaborate in plans. So it's not just that we're doing in isolation. We actually plan interventions together, and we implement together.
Okay, Ms. Hannatu, because you are the one in the mobilization department, unit, you go to these communities a lot. What can you say about these water sources for these communities that you have seen? I remember RUASA, alongside Water Aid and other international organizations, have been making effort to provide sources of potable water for schools in rural communities. I've been to the one they launched in Buhari. I don't know how far that has gone, because in my tribe, they say if you say people should not follow through the back door, then leave the front door open. If you are asking people to not do open defecation, then what's the alternative that you are providing? So talk to us about water sources particularly, and sanitation facilities that you have found in most of the FCT communities that you have visited.
Thank you. Like concerning the water aspect of it, FCT is trying, because in most of the communities, apart from the public health and RUASA and Water Board, other agencies, other partners, they come to help creating borehole around the communities. And in other way, if they don't have that kind of a borehole, we always advise. We ask them to go the local way. There's this safeguard, or things that can make them use the water, that can make them have the water. When they get the water from the source where they are getting the water from, we advise them to boil the water. They should get a very good container, very clean container with a cover. Okay. And when they boil this water, there is this sieve they will carry. They will use it to cover. Then they will sieve the water and allow the water to get cold. I think that water is a bit okay for them to take at that time of need. But as of now, if the borehole is not there, that's the only thing we advise them to do. And we always want to demonstrate to them wherever we're in the community, this is how they are supposed to do. We don't run away from them. You go into the community, you enter, you want to achieve something from somebody, and the person is giving you something you are rejecting. No. What we do is we follow them the way they are, so that they will now allow us to chip in that which we want them to do, not for only them, for our children and even for us within FCT. So issue of water, they are trying, and these are the major aspects that we've taken about water. And for open defecation and something, we advise them, in case they don't have toilet, they don't have anywhere to do, we ask them, when you go to the bush, it's not bad. Sometimes they go to the farm. In the farm, if they feel like defecate, just make a small hole. Finish whatever you want to finish. Use the sand you dig from the hole, cover it back. Go home, wash your hand, and listen. But if they leave the distance on the surface, when rain falls, it will clean that defecation down to the river where they are using to fetch, to drink, and to wash their clothes. So those are just the advice we give them for now and even for time to come, until everything is improved. Okay. So this thing.
All right, Dr. Theresa, before we wrap up, it's rainy season, and you rightly mentioned that cholera is a seasonal disease that comes around, especially when the rains fall. FCT witnessed flooding in some parts, particularly Treadmore Estate area, just yesterday. Now that we are here, you know, from your own point of view as the state chief epidemiologist, what would you be telling us to do so that we all stay safe? Because government, like you've said, government have its own role, but essentially we as a people also have our own rules. What would you be telling us to keep us safe and our loved ones?
Thank you so much. The rains we've not reached the peak of the rains. Okay. It is not likely that we've reached the peak of the rains. From NIMET projections, rains are still coming up till August. We're likely to have much higher levels of rainfall, which means that we are not out of the woods yet. So the advice we would give is the advice we've always given. For areas that are prone to flooding, it's important that people stay safe. So if people need to relocate temporarily, it might be recommended rather than get into trouble. And some of those places you find, especially depending on the topography of the land, the recipients of this water are the ones who get more into trouble. So when homes are flooded, when facilities are washed away, sanitary facilities are washed away, then the outbreak has the chance to exacerbate. And you find that places that are at vulnerable, you know, IDP camps, Congress sections, schools, and all of that, they are most susceptible. So we recommend that people should wash their hands, keep their environments clean, wash the fruits and veggies that they eat. If you can, stay away from street food at this point. Strongly recommended. Very important. Strongly recommended. We love street food. I love street food. I love to eat corn. And I assume that, yes, the corn is over fire, it's hot, but remember the number of people who touch the cup of corn and they don't like it. Also, they touch and then they leave it. They touch the pear, they leave it, and then you come, you buy, you eat. And corn, and especially corn is not something that you say you will wash, especially the roasted one. Right. So, I'm not trying to spoil anyone's market. I'm just saying, be very, very aware. Please. Whether you're buying roasted plantain or roasted corn, anything that is street food that is not cooked hot and delivered immediately, watch out, because some of the times these are the things that vehicles of getting the bacteria to us. Remember your fruits and vegetables. You buy cucumber, you buy carrot, you buy garden eggs, you're on the go, you're in the car, you start eating before you get home. Watch out for those things, because these are the vehicles, these are the points of transmission of the bacteria to us. And then don't assume that just because you have washed these things that they're clean. What is the source of water? If you bring contaminated water, water that is contaminated by the bacteria, and then you use it to wash your food and vegetables, and you make a salad out of it, then you could get infected. And you say, oh, but I washed the vegetables. The water source was already contaminated. So stay safe. Right now, please, we want to reassure everyone that the FCT is doing everything. I'm telling you, we're no longer in offices, we're on the field. We're checking registers, we're checking to be sure that we're not missing anything. We're out last week, we're out as far as Orozo, Damangaza, we're going to villages. We're not sitting in our offices. We want to be sure that if anything happens, we pick it up immediately. And so, but we're hoping nothing happens. Again, if you find anyone who is stooling, sometimes mothers would say, oh, it's teething. They attribute something to teething. So they stay, they wait, or they say, wait till tomorrow. Please, cholera doesn't give chance. The stooling is so effortless. The stooling is so easy to identify. So we usually describe it as rice water stool. It looks like when you boil water, rice, right? You pour out that water. It's kind of creamy, it's kind of milky. Cholera is so typical, it looks like that. If you see that kind of stool, please don't wait. Go to the health facility. If somebody is stooling, maybe before you leave home, salt, sugar, solution, ORS, give it to the people, move them to the hospital immediately. It is easily treatable. with simple infusions, with simple antibiotics, people will get well. So what kills is the dehydration, the loss of fluids, especially in children. So if somebody is stooling, don't say, let me watch it. Just go and report in the hospital. You'll be tested, and then we'll know what to do thereafter.
I was actually going to ask a question which you've already sufficiently provided an answer for, which has to do with the symptoms to watch out for. But since you've given us the symptoms, you've in passing mentioned visit health facilities. What are the facilities, where are the facilities available, especially in FCT, for people to easily go to?
So we recommend that you go to the nearest health facility to you. If you are in a very remote area, there must be a primary health care center. When you go there, first of all, they'll be able to start some first aid. So again, the symptoms are really very simple. There's vomiting, there's diarrhea. Usually there'll be no fever. You're not likely to see fever, right? So there's stooling, and then there's dehydration. Watch out for children. If you notice a child who is very restless, the child has been stooling and is extremely restless, rushes water. When you give them water or you give them anything to drink, they rush it. That child is becoming dehydrated. You want to watch out for signs like that and get them to help as soon as possible. So those are the simple symptoms and signs that you can see. And then when you come to a health facility, ORS will be started immediately. And if the primary healthcare center nearest to you cannot deal with it, they will refer you to the secondary facility in also close to you.
Thank you very much, Dr. Theresa Ekaete, who, of course, Nwachukwu, the State Epidemiologist, FCT Public Health Department. And I come to you, Mrs. Hannatu, Bitrus, for your final words before we call it a day.
Yeah, my final word is we advise mothers to do the local ORS in the house. Whenever we go to the community, we demonstrate. We tell them what to use and how they go about it, so that before they get to the available facility, they must have started rehydrating the person from the house before they get to the facility. So we keep advising. We should please keep our environment clean. Hand washing is very good. Our children, we should observe and monitor whatever they eat in and out. And we should always be observant to our children. Sometimes they might not say this. If you are not a careful parent, you will just allow them. Before you know it, something serious will happen. So please, we should be vigilant. Not only our children, even in our environment, we should really be vigilant.
Thank you very much, Mrs. Hannatu Bitrus. She is the Health Educator and Social Mobilizing Officer, FCT Public Health Department. She has been supporting Dr. Theresa Ekaete Nwachukwu, who is the State Epidemiologist, FCT Public Health Department. Sincere thank you to you for what you're doing for our country, and we continue to pray that, as you wish, this number remains like this.
Yes.
We don't want FCT to contribute to any of those very negative and ugly numbers.
Yes.
Thank you very much for the work you're doing, and thank you for coming on ASO Morning today. Of course, as you are aware, ASO Radio and TV is always here to provide the support needed, especially as it has to do with awareness creation as far as what you do is concerned. Thank you once again very much for coming.
Thank you for having us.
And it's on this note that we draw the curtains on today's edition of ASO Morning from Atop Katampe Hill on ASO Television. My name is Usman Katun Umar, urging you to, of course, obey all that have been told you to keep yourself and your loved ones safe from this outbreak of cholera and even other communicable diseases that have to do with the environment. Simple things that you can do. Minister, PAMSEC, Monday Secretary, they have their own jobs to do and they are doing them. What about you? You have your own role to play to keep all of us safe. Do it now. Do enjoy the rest of the day, and bye for now.